Tragedy strikes. You're rushed to the ER. You're in good care, right? Short on doctors, long on wait times, and outdated equipment.
You don't need to have queues.
The nation's former top doc speaks out on Canadian healthcare.
30% of the public don't have private insurance.
Why he's making such a racket on this edition of Fraser TV. I'm Leah Costello. Dr. Brian Day is a big name in Canadian healthcare. He's published over 100 medical articles, received numerous awards for his work as an orthopedic surgeon, and lectured all over the world on the issues of healthcare. But Dr. Day is a controversial figure. He wants to see more private sector involvement in Canadian healthcare. We caught up with him at his private clinic in Vancouver. What is the impact of waiting times on our healthcare system?
Waiting for healthcare leads to deterioration, and that deterioration has medical costs for the patient, but also major economic costs for society. I would see a 20-year-old who's waited 9 months for a simple knee operation that might just take half an hour, that might cost a couple of $1,000s to the system to fix, and that person waits 9 months. The knee joint suffers irreparable damage, and 15 or 20 years down the road, that patient will cost society hundreds of thousands of dollars.
Is there a reasonable time for someone to wait for surgery?
I don't like that idea. I don't like benchmarks of 6 months and 4 months and 6 weeks for cancer. I think we should be looking instead at the best practices. What's the best? Because Canada should be the best. We should have the best health system in the world. And to me, to be looking at, for an elderly patient to wait 6 months in pain, taking painkillers, deteriorating, is not a best practices health system. Canada should be the best in the world, and it can be. Instead, we're according to the World Health Organization, 30th in the world. According to the European Consumer Health Powerhouse, we're 23rd out of 30 European countries, and worst of all, bottom out of those 30 countries when it comes to value for money.
What do you think needs to be done to further decrease or eliminate wait times completely?
Change the funding system of hospitals so that money follows the patient. We call it patient-focused funding, where instead of giving the money in a big block to an institution like the Vancouver Hospital, for instance, getting $1 billion a year to do everything, what happens in that block funding system is that every patient who goes there is using up their money. If instead the money follows the patient, then if a patient goes there for an MRI that costs $750, the institution gets that money. If a patient goes there for a hip replacement that costs $15,000, the institution gets rewarded as opposed to being punished economically. I think that's the single biggest step we need to take. And we're now the last OECD country that almost exclusively block funds hospitals. We now have evidence from around the world that changing that funding system to where a patient becomes a value and not a cost to an institution changes the whole outlook of management and improves the efficiency. And in England, since 2004, long wait lists have been completely eliminated by changing that funding system. It does require some expenditure to get rid of the million Canadians on a wait list. Will require some expenditure, but I think we have to look upon that as an investment with a real return on investment, because we've done studies at the Canadian Medical Association that show it's cheaper not to have wait lists, that people waiting not only are a cost in terms of their healthcare, but are an economic cost because they're out of the workforce, they're not paying taxes, they're often receiving benefits from government or insurance. So there are many reasons to eliminate wait lists. That's the single biggest step we could take to achieve that goal.
So as president of the Canadian Medical Association, you've had a lot of experience with healthcare in other countries. You've seen what other countries have done. Do they have waiting lists there?
In many countries, France, Belgium, Germany, Switzerland, Austria, and now England, that you don't need to have queues in healthcare. That people, when you spend the amount of money Canada spends, there should be no queue. And the reason we have a queue is we have a very inefficient public system. The public system has no competition. The hospitals don't compete with one another. So I think Canadians have been hoodwinked into thinking that there has to be a queue, there have to be wait lists. Well, they don't. And many countries have no wait lists. And that's what, once you eliminate queues, there's no queue jumping. That's where we should be going.
Great.
I mean, I think this is what people tend to forget. They equate alternatives to the Canadian health system with Americanization, which is not what we're talking about. We're talking about countries like Belgium, Switzerland, and France, and Austria that have, they do have mixed public and private funding and delivery of healthcare. But the difference between the private and the public in those countries isn't faster care, because everyone gets fast care.
So why do you advocate privatization?
Right now, there is no true competition between institutions. Once you introduce some competition, then the patients become a value, and you'll have, for example, if there's a 4-hour wait in the emergency department at St. Paul's Hospital and only a 2-hour wait at Vancouver General, patients will go to Vancouver General. Vancouver General will get the revenue, and the poorly performing emergency department will lose revenue and suffer. Therefore, management will change accordingly to make it more efficient. So that competition is something that's been lacking in the health system, and we need to introduce it.
So do you think there's a role for private insurance?
We in Canada have accepted a situation where it's legal to insure yourself for death, but not for illness. And there's something wrong with that, that to not be able to buy your own insurance because the government doesn't want to offer it to you. And yet, there is not probably a full-time unionized worker in the country that doesn't have private health insurance that gives them beneficial and improved access to drugs and technologies and private rooms in hospitals and dentistry and so on, or many of an ambulance when you have chest pain and need to go to the emergency. These are all areas that for someone, and it's not a physician, someone has designated as being medically unnecessary. They're absolutely necessary medically, and yet in Canada we only cover them if you have private insurance. In Canada, 30% of the public don't have private insurance, therefore they have inferior healthcare. Therefore, the myth out there that we have universal equality in healthcare is that. It's just an absolute myth.
And for more information on this topic, you can read the complete Waiting Your Turn report at fraserinstitute.org. That wraps up this edition of Fraser TV.